The causes of Rett syndrome. It is caused by mutation of the MECP2 gene, which is methyl CpG binding protein 2, which is found in the X chromosome. The X chromosome is a sex chromosome. The female has 2 X chromosomes, and the male has XY chromosomes. This mutation is the most prevalent cause in Rett syndrome cases. The MECP2 gene is responsible for producing the MECP2 protein, which is needed for proper brain development and development of the nervous system. This mutation causes the gene not to make enough of the MECP2 protein, or it is a damaged protein that cannot be used by the body. If there is not enough working protein for the brain to develop normally, Rett syndrome develops. Rett syndrome is not inherited, it just happens randomly. In more than 99% of people with Rett syndrome, there is no history of the disorder in their family. There is a few percent where it is inherited and passed by female carriers. In some cases where there is a member who is affected by the disease, other female members may have the MECP2 gene but do not show symptoms and are known as asymptomatic carriers. If there is a daughter in the family with Rett syndrome, then prenatal testing is done to see if there will be more babies born in the family who will get the disease. Incidence of Rett syndrome. Rett syndrome is more common in girls than in boys. This is because the girls have the XX chromosomes and the boys have the XY chromosomes. Since the MECP2 protein affects the X chromosome, there is a greater chance of the girls getting Rett syndrome since they have 2 X chromosomes. Boys may get RTT, but the chances are extremely low. The incidence of RTT is 1 in 10,000 to 15,000 girls in all racial and ethnic groups worldwide. These numbers may be higher since the disease is often misdiagnosed and testing is not done properly or done later on.